Hello students, welcome back to Easy Nurse, where nursing education made easy. So today we are Easy Nurse here for the Adult Health Nursing 2 exam live. Okay, so let's start about today's live. So in this live, I am giving you some important topic from every chapters. Okay, other than that, I'll say you about the another important questions which you have to give focus other than this questions. Okay, so if you follow those questions, so during exam time definitely will get many questions from this series. Okay, so listen very carefully, so follow those questions as well as whichever question I'll tell, just note it down on your notebook. So let's start about today's session. So first we are going to see regarding the foreign bodies from the ENT chapter, ear, nose and throat. Okay, so from unit 1. So first is the foreign body. It's nothing but presence of the foreign bodies in our external ear. Okay, so in this, what is the causes to presence of the foreign bodies, like accidental or as by the deliberate insertions of the foreign bodies in the ear, or sometimes foreign bodies as like sharp object or small insect. Okay, so what are the clinical manifestation, like discomfort feeling, diminished the hearing, then feeling of the movement or hearing or buzzing, then trauma due to the sharp object and redness and swelling. So now come to the otalgia. This is also one of the most important questions due to the presence of any kind of foreign bodies and all. So otalgia, it's mainly they're asking in the exam time either in 2 marks or the 5 marks. Okay, so otalgia is nothing but it's defined as a pain in the ear or ache, means earache or ear pain is known as a otalgia. So what are the causes? Infections in the ear, bacterial contamination can enter in the ear, uncleared articles, or else insertion of the sharp object on the ear. Okay, so what are the risk factor? Installations of the contaminated solution, swimming in the polluted water, trauma to head or enlarge of the adenoid tissue and mouth or gums main. So now come to the clinical manifestation, like blue or the reddish purple discolorations, then tense swelling over the pinna and then pericardial hematoma. So now come to the management, like analgesic for managing the pain and for antibiotics for the prevention of the treatment. Okay, now come to the impacted cerebrum. So impacted cerebrum is nothing but it's accumulations or the earwax which is obstruct the external acoustic means. Okay, so what is the causes? Excessive thick or the dry cerumen release. So now come to the pathophysiology of the impacted cerumen, that is etiological factor. So due to this etiological factor, amount of the cerumen which is secreted is going to decrease, and increased amount of the keratin. Okay, so due to this increasing amount of keratin which is causing cerumen to be drier as well as harder, so what is happened? The cerumen is going to be impacted and block the ear canal. So what are the clinical manifestations? Sense of fullness in the ears, otalgia, diminished hearing. Patient there ask about the words by repeatedly as well as manifest the questions and then raises volume on the television. So what are the management and treatment? Treatment, this typically involves in removing the earwax through the irrigation or else manual remover with specialized tool, use of the cerumenolytics or to soften the works, and prevention focus on proper ear hygiene, avoiding the use of the cotton swab. Now come to the otitis media. That is also one of the most important question for the 5 marks or 2 marks. Okay, so otitis media is nothing but it's a inflammations of the middle ear. So what are the types? There are mainly 2 types, acute and then chronic. So acute otitis media is nothing but you can see the most rare case, most common cases in the acute otitis media. Okay, so it involves a sudden onset of the inflammation or infection in the middle ear. And chronic otitis media or perforation of the tympanic membrane is nothing but which refers as a persistent or the recurring infection or the inflammation of the middle ear, which often with the presence of fluid damage the tympanic membrane, destroy the ossicles and involves the mastoid bone of the ear. So now come to the causes of the otitis media. First is infection like bacterial or viral, then eustachian tube dysfunction, then environmental factor and then genetic factors. So what is the pathophysiology of the otitis media? First is infection via eustachian tube due to fever or something, then it leads to the inflammation of the middle ear, which leads to the buildup of the pus in the middle ear, which leads to the bulging eardrum or the pain, so which leads to the thinning of the eardrum followed by the rupture, and it leads to the ear discharge. Okay, Now come to the signs and symptoms of the like otitis media. First, hearing difficulties, difficulty sleeping or staying asleep, then fever, ear pain, loss of balance, fluid drainage from the ear. Okay, so now come to the diagnostic evaluation. First, obviously medical history collection, physical examination, tympanometry. So tympanometry is nothing but it's a functions of the middle ear which is measuring the like resonance of the middle ear in response to the changes on ear pressure. Okay, so that is called tympanometry. And now come to the audiometry. So audiometry is nothing but it's a branches of the audiology. It's a medical branch. Okay, so which is measuring mainly the hearing sensitivity in different kind of the high pitch, low pitch, or means frequency or the different kind of intensities. Okay, so that is called audiometry. So now come to the treatment for the acute otitis media. First is observation in the middle cases, mild cases, and especially in the older child or the adults. For the antibiotic like amoxicillin, pain management, either ibuprofen or the acetaminophen, which can help the manage pain and fever, and then decongestion or the antihistamines. For the chronic otitis media, antibiotics, ear drops. For the chronic suppurative otitis media with ear discharge, then surgical interventions like tympanoplasty. So tympanic membrane, they need to surgery. Now come to the ossiculoplasty. Now come to the mastoidectomy. Mastoidectomy is nothing but removal of the mastoid bone. So these all are the treatment of the otitis media. Okay. Now come to the Meniere's disease. This is the most important for the 2 marks question. Meniere's disease is nothing but it's a chronic disorder of the inner ear. Okay, so what are the causes? Like swelling of the endolymphatic sac, otitis media, hair injury, viral infection, use of the medication such as aspirin. So what are the symptoms? Like first is vertigo, endolymph, then tinnitus, like nausea, vomiting, then nystagmus as well as hearing loss, and then drop attack. So what are the diagnosis? History collection, physical examination, electrostegmography showing normal or the reduced vestibular response. Now come to the electrocholeography as well as CT scan or the MRI of the ear. So what are the management for the medication like anti-vertigo medicine? As example, drugs like a maclizine or the diazepam, which can control the vertigo during an attack, and then antiemetics as well as the corticosteroid. So now come to the dietary changes. For that, a low sodium diet we have to give to the patient, which will be helpful for reducing the fluid retention as well as potentially the lessen symptoms, and it's also avoiding the caffeine, alcohol, and tobacco. Now come to the lifestyle modification. So for that, stress management techniques, as the stress can exacerbate symptoms, and then regular exercise as well as healthy lifestyle. Now come to the vestibular rehabilitation therapy. So for that, a form of the physical therapy which designed for improving the balance and reduce the dizziness through the various exercises as well as the techniques. Now come to the surgical management. So for this, mainly endolymphatic drainage and then shunt procedure. So now come to the glaucoma. This is also one of the most important questions for the 5 marks. Okay, so what has happened? So from the last unit, means ENT unit, so other than this topics, the another important topic, please note it down, that is epistaxis from the nose as well as from the throat, that is thyroid gland and their disorders. Okay, so these two are the most important questions from the ENT topic. So now come to the eye chapter. So first is glaucoma. This is also one of the most important questions from the eye unit. So glaucoma is nothing but it's a group of disorder which is mainly characterized by the abnormal increasing the IOP. IOP is nothing but intracranial pressure, intraocular pressure, then optic nerve dystrophy as well as peripheral visual field loss. Okay, so what are the causes of the glaucoma? Aging, then genetics as well as the eye trauma, then hypertension, next one is a severe myopia, then ocular surgery, then black ethnicity, diabetes mellitus, migraine headache, then extreme dilation of the pupil, then degenerative changes in the tubercular meshwork, then prolonged use of the local or systematic corticosteroid. So now come to the pathophysiology of the glaucoma. Due to this etiological factor, disturbance in the circulations of the aqueous humor. Okay, so aqueous humor is a fluid which is mainly helping to maintain the hydrations of our eyes. So disturbance in the circulations of aqueous humor in all over the ocular structure. So what is happen? Increase the IOP or intraocular pressure, means the aqueous humor production is increasing. So that for that reason the IOP pressure is also going to increase. So due due to this increase the IOP pressure, it's going to damage the retinal layer as it passes through the optic nerve to head, and which is mainly compression of the optic nerve head. So due to this resulting in the cell injury and death. Now come to the types. So what are the types? Mainly congenital and then backward. So for the congenital, like true congenital glaucoma, and second one is the infantile glaucoma, and as well as the juvenile glaucoma. Okay, now come to the acquired. So for the acquired, mainly two types, primary and secondary. So for the primary open angle glaucoma, primary angle closer glaucoma. So now come to the next, that is acquired glaucoma. One by one we'll discuss. Okay, so acquired glaucoma is nothing but it's also known as a primary glaucoma. Okay, so under this primary glaucoma, first is acquired glaucoma. So under this acquired glaucoma, first sub point is primary open angle glaucoma. So what is this open angle glaucoma? Which mainly result for the overproductions of the outflow of aqueous humor through the trabecular meshwork, which causing the increased IOP and damage to the optic nerve. Okay, so they see the angle between the iris and then trabecular cornea is increasing. Okay, so that is called open angle glaucoma. So what is happened? The outflow of the the outflow of the aqueous humor, which is happening through the trabecular meshwork, is going to be increased, means more and more. So that's why here the IOP pressure is going to increase. So that's why it's called as a primary open angle glaucoma. So what are the symptoms? Mild itching, mild headache, blood vision, IOP greater than 24 mm of Hg, halos around light, then difficulty in the night vision, difficulty in the color detection. Now come to the next, that is primary angle closer glaucoma. So here what is happened? The angle between the iris and then cornea is becoming very close. So the productions like blockage of the drainage pathway in the eye, so which is mainly leading cause of the intraocular pressure increasing. So for that glaucoma is coming. Okay, so what are the symptoms? Pain and redness in the eyes, IOP greater than 40 to 70 mm of Hg, blood vision, optic nerve hyperemic, then halos around right, headache, then decrease the visual acuity, photophobia, as well as the cornea edematous. Now come to the secondary glaucoma. So mainly for secondary glaucoma is nothing but it's a result of causing of another disease or the problem with an eye, such as uveitis, inflammation, trauma, intraocular hemorrhage, previous surgery, diabetes, tumor, or any certain medication such as steroids. So what are the symptoms? Like eye pain, redness, blood vision, halos around night, nausea and vomiting, headache, lacrimation. Lacrimation is nothing but excessive tearing. Okay, now come to the corneal edema and then photophobia. So what are the diagnostic evaluation for the glaucoma? First one is the clinical assessment. Okay, second one is the tonometry. So tonometry is nothing but it's a procedure which is mainly used by the eye care professional for measuring the IOP. IOP is nothing but intraocular pressure inside of our eye. So that is called tonometry. Next one is the ophthalmoscopy. So ophthalmoscopy is nothing but it's mainly help to examine the eye like anatomical structure, especially the fundus level. Okay, eye fundus level they are mainly going to check. Now come to the gonioscopy. So gonioscopy is nothing but they are mainly examine the angles between the iris and then cornea, which is also known as a anterior chamber angle. So if it is angle is greater than 40 to 45 degree angle, so it means like open angle glaucoma. Okay, and if it is less than the minimum 30 to 35, so it means like angle closer glaucoma. Okay, so based on the angle through the gonioscopy they are going to detect. Now come to the perimetry. Perimetry is nothing but they are mainly measuring the person's visual field. Okay, now come to the slit lamp examination. So slit lamp examination is nothing but it's a detailed microscopic examination which is mainly assessing the health status as well as the functions of the eye structure, means fundamental as well as anatomical. Now come to the fundus photography, which is nothing but it's a they are mainly taking the pictures by X-ray or CT scan or MRI through the fundus level of the eyes to see the anatomical structure, and then baseline data. Okay, so that is called fundus photography. So now come to the medical management. So what are the medical management? First is beta adrenergic blocker. Now come to the cholinergic, mainly for the pain, and then carbonic anhydrase is nothing but it's mainly block the activity of the enzyme, which is mainly helps for productions of the fluids in the eyes. Okay, so now come to the prostaglandin analogs, and now last one is the osmotic agent. Now come to the surgical management. So first is argon laser trabeculoplasty, mainly they are creating this surgical assessment on the trabecular meshwork. Now come to the next, that is laser iridotomy. Now third portion is the cyclotherapy, and the fourth one is the cyclodialysis, and last one is the filtering procedure. So these all are the surgical management. Now come to the nursing management for the glaucoma. First is assess the intraocular pressure, administer the medication based on the physician order, monitor the complications. Fourth one is prevent the visual deterioration. Fifth one is encourage the patient to wear the black glasses. Next, positioning the patient by elevating the head up to the 30 degree. Then advise the patient for avoid the rapid movement or the bending. Advise the patient to avoid the prolonged vomiting or the coughing. Okay, so now come to the next important condition, that is conjunctivitis. That is also one of the most important condition for 5 marks, 10 marks or 2 marks. So mainly this is the conjunctivitis. For the 2 marks they are frequently asking about the types of the conjunctivitis. Okay, so see, conjunctivitis is nothing but it's a redness and then inflammations of the membranes which is covering the white part of the eyes and the membranes on the inner part of the eyelid. So that is the conjunctivitis. So what are the causes? Exogenous causes and then endogenous causes. Okay, so what are the types? See the types. Bacterial conjunctivitis, it will be spread from one person to another person. Then viral conjunctivitis, that is also. Allergic conjunctivitis, it will not spread from one person to another person. Chemical conjunctivitis also might be spreading. Then neonatal conjunctivitis, it is also spreadable, and then giant papillary conjunctivitis, it will not be spreadable. Okay, so these all are the types of the conjunctivitis. So now come to the next, that is bacterial conjunctivitis. So bacterial conjunctivitis is nothing but it's infections of the conjunctiva which is mainly caused by the bacteria, and it's also caused by redness, swelling and discharge from the eyes. Okay, so you can see for this bacterial conjunctivitis mainly the yellowish type of the discharge you can see from the eyes of the patient. Okay, so what are the types and causes? First type is the acute mucopurulent, acute purulent, membranous, pseudomembranous as well as the angular. So acute mucopurulent, under this the streptococcus virus, haemophilus virus and then pneumococcus virus. So due to these three type of the virus the patient will get might be acute mucopurulent. Now come to the acute purulent like Neisseria, gonorrhea. So for this acute purulent, membranous is causing as a Carbonibacterium diphtheria. For the pseudomembranous, streptococcus, pneumococcus and then gonococcus, and for the angular like this diplococci. Okay, so now come to the next, that is clinical manifestation. First is the eye pain. So if the person is having conjunctivitis, obviously the patient will get a severe eye pain for certain times, and it will be like a frequently basis, not like intermittent basis, not as a frequent. Okay, sometimes they will feel the pain and sometimes it will be subside. Again when they are focusing something, again the pain will come. Okay, so that is like this intermittent pain the patient will get due to the conjunctivitis. Then burning sensation, you can't focus on any object like for some time. Then photophobia, when you are getting in the sunlight or any excessive light, so obviously you can't able to like look up on this particular object. Okay, now come to the swelling. Eyelid will be very swelling and it will be like a very like redness. Okay, now come to the redness for the like inner part as well as the external part. Then gritty feelings, like you will feel something is present inside in your eyes. Okay, like as a foreign body sensation you will feel. Okay, so that is called gritty feeling. So these all are the clinical manifestations. So now come to the viral conjunctivitis. So it is often referred as a pink eye because the eye is becoming pink pink, not as a red. Okay, so it's inflammations of the conjunctiva. It's a thin clear tissue which lies over the white part of our eyes, and it also lines the inside of our eyelids. So it's a condition which is usually caused by viral infections and highly contagious. Okay, so what are the types and causes? There are mainly three types. First is acute herpetic conjunctivitis, epidemic keratoconjunctivitis, pharyngeoconjunctival fever. So under this acute herpetic conjunctivitis, herpes simplex virus. So due to this virus, the patient will get this conjunctivitis. So next one, type 8 and type 19 adenovirus. Due to these two type variant of the adenovirus, epidemic keratoconjunctivitis will happen. And type 3 and type 7 adenovirus, due to this two variant pharyngeoconjunctival fever, the patient will get. Okay, so now come to the clinical manifestation, same as like a eye pain, enlargement of the lymph node. So if the patient is diagnosed under the viral conjunctivitis, this is a one like a landmark. Okay, so through this we can able to understand like the patient is having like a viral conjunctivitis, because lymph node is going to be very enlarged near to the ear part. Okay, now come to the photophobia. Next symptom is swelling, then redness as well as a gritty feeling. Okay, so now come to the next topic, that is allergic conjunctivitis. It will not spread from one person to another person. Okay, so allergic conjunctivitis, it's inflammations of our conjunctiva due to the allergic reaction. Some people are having a dust allergy, so when they're exposing more in the dust area or something, so they will get this allergy, means conjunctivitis is coming at a certain time. Okay, same as like any whole grain or something like leaves and all, if they're having any allergy, so if it is somehow touched to your eyelid, the people will get definitely the conjunctivitis at that time. So that is called allergic conjunctivitis, and this condition is common, can affect one or both eyes. Okay, so now come to the types and causes. So what are the types? See the simple allergic vernal, then atopic keratoconjunctivitis, contact dermatoconjunctivitis, and then phyllic neuter. So what is the simpler allergic, like vegetables, pollens, dust, drugs, etc. From the vernal, like family history, rhinitis as well as asthma. Then atopic keratoconjunctivitis, like a pollens as well as a inhalants. Then contact dermatoconjunctivitis, like chemicals or the drugs, and then phyllic tenular. So under this bacteria and type of the cell medication. Okay, so these all are the types and causes of allergic conjunctivitis. So what are the clinical manifestations? Same, eye pain, severe eye pain, you will get burning sensation. Next, photophobia. Fourth one is the swelling of the upper and lower eyelid, then redness and gritty feeling. This is also one of the landmark of the allergic conjunctivitis. Okay, so now come to the chemical conjunctivitis. So when this conjunctiva is going to export for the some toxic agent or chemical agent, so that time it's known as a chemical conjunctivitis or the toxic conjunctivitis. So inflammations of the conjunctiva which is caused by exposure to the irritants or the chemicals. So what are the causes? First is the chemical splashes, then the medications, third one is the environmental irritants, and then cosmetics. So what all are the symptoms? Redness of the eyes, second one is the watery discharge from the eyes, burning sensation, swelling of the eyelids, then sensation of the foreign body, then blood visions. The people will get the blood visions. Okay, so now come to the neonatal conjunctivitis. This is also spreadable. So it's also known as a ophthalmia neonatum. Okay, so it's an eye of the infections which occurs in the newborn baby, typically the first month of the life, and it can be caused by the various infectious agents, most commonly bacteria and virus. So what are the causes and type? Bacterial infection, viral infection, and chemical conjunctivitis. So under this bacteria like chlamydia, then trachomitis, Neisseria, gonorrhea, staphylococcus aureus, haemophilus influenza, streptococcus pneumoniae. So what is happened when if the mother is having any sexual transmitted disease or any other infection? So for this, when the baby is coming through the normal vaginal delivery, so when they are facing is towards to the vagina, they're passing this vaginal area, so that time if the bacteria somehow exposed to the eyesight, means the newborn baby is getting this type of the infections. Okay, so what are the virals causes? Like herpes simplex virus, then chemical conjunctivitis like a silver nitrate. Okay, so now come to the symptoms. Discharge from the eyes, how which type of the discharge? Like grayish yellow. Okay, now come to the swelling eyelids, then irritability and then discomfort, redness and swelling of the conjunctiva. So now come to the diagnosis of the conjunctivitis, clinical examinations. Next one is the swabbing of the conjunctiva. Next one is the blood test. Swabbing of the conjunctiva is nothing but like it through the earbuds. They will be put any anesthetic drops in your eyelids, and if it what is the cause, so to know for this factor they have to swab this conjunctiva like sample. Okay, so after that they will send this sample to the laboratory, and under the microscope they will see what is the main cause of the conjunctiva. So that is called the swabbing of the conjunctiva. Next one is a blood test. Okay, so what all are the treatment? Bacterial conjunctivitis like erythromycin, azithromycin, ceftriaxone, gentamicin. For the viral conjunctivitis, acloclovir eye drop as well as an antiviral drop. So if the mother is like a HIV infected person, and for that if the baby is coming, so for that acloclovir, this eye drop also given to the newborn baby. Okay, so now come to the chemical conjunctivitis like a saline eye drops. And now come to the next topic, that is giant papillary conjunctivitis. So giant papillary conjunctivitis is nothing but it's a type of the chronic conjunctivitis which is characterized by the formations of the large papille on the inner surface of the upper eyelids, so which is mainly often associated with the use of contact lens, ocular prosthesis or exposed sutures. So what all are the causes? Contact lens use, ocular prosthesis, sutures and other ocular foreign bodies, as well as the allergic reaction. So what all are the symptoms? Redness and swelling of the conjunctiva, mucus discharge from the eyes, blurred vision. Next one is the foreign body sensation, increase the lens movement, and itching and discomfort in the eyes. So what all are the treatments? Same like medications like antibiotic, analgesic, etc., improving the lens hygiene. Next one is the reducing the lens wearing time, minimum 5 hours they have to put this lens. Next one is the discontinue the contact lens uses, switching the lens type or the care regimen. So what all are, so these all are the important topic from the eye chapter. Okay, other than that some more important questions are there from this eye chapter, so that is just note it down. First is the refractive error. Okay, types of refractive error and their management. Second one is the cataract, especially the management of the cataract. Next one is the retinal detachment. Mainly this retinal detachment is important for the 2 marks question. Next one is the ocular prosthesis. Sometimes they are asking as a 5 marks questions. Then eye bank is also one of the most important questions for the 5 marks. And next one is the blindness control program. So these all are also most important topic from this chapter. So now come to the next chapter, that is the urine formations. Okay, so under this chapter of most important topics I am saying, first is the glomerulonephritis. Okay, so under this glomerulonephritis, what is this? It is a type of the kidney disease which is characterized by the inflammations of the glomeruli, which all are the teeny filters in the kidneys which remove the waste as well as the excess fluid from the body, right? So what all are the types? Acute and then chronic. So acute means which is occurs suddenly, of which is often following an infection such as the strep throat, and it's also characterized by the rapid onset of symptoms like hematuria, proteinuria and then hypertension. So now come to the chronic glomerulonephritis, which is developed slowly over the several years, and it's also lead to the gradual loss of our kidney functions. Often they're presenting the symptoms like proteinuria, hematuria and hypertension over a long period of time. So what all are the causes? First is the infection like bacterial infection, streptococci, throat infection, viral infection which is like a hepatitis B and C, and then parasitic infection. Now come to the immune disease. So under this condition such as the lupus and then Goodpasture syndrome. Now come to the vasculitis like inflammations of the blood vessels as like a pyrolytis, then nodosa as well as the granulomatosis with a polyitis. Now come to the other condition like diabetes, hypertension and then amyloidosis. So what all are the pathophysiology? So come to the symptoms like hematuria, which presence of the blood in the urine which make it appear pink. Now come to the proteinuria is nothing but it's excessive urine in the like excessive protein in the urine which is causing a foamy urine. Now come to the edema, which is swelling in the face, hand, feet and then abdomen due to the fluid retention, and then hypertension like a high blood pressure. And oliguria is nothing but decrease the urine output. Then fatigue, general feeling or the tiredness or weakness, and then shortness of the breath due to this fluid accumulation in the lungs is also known as a pulmonary edema. Okay, so now come to the diagnosis. First is the urine analysis. Check the blood as well as the protein and the albumin level in the urine. Then blood test, measure the levels of kidney function indicators like a creatinine and then blood urea nitrogen. For the imaging studies like a USG or the CT scan for the visualization of the kidney biopsy, removal of the small kidney tissue sample for the macroscopic examination, and then serological test like which detect the antibodies and markers of the autoimmune disease or infection. So now come to the management like medication, which all are the prescribing anti-inflammatory drugs, immunosuppressions as well as the antibiotics if any infection is present. Now come to the blood pressure control, which is using the ACE inhibitors, ARBs or other antihypertensive drugs. Dietary changes, which is mainly reducing the salt, protein and then fluid intake for the lessen kidney workload. Now come to the diuretics, which is managing the fluid retention and then swelling. Treating the underlying conditions, which is mainly addressing the root cause such as autoimmune disease or the infection. Then dialysis for the severe cases, perform the kidneys filtering functions, and for the monitoring regular follow-ups for tracking the kidney functions and then adjust the treatment if it is needed. Okay, so now come to the next topic, that is urinary tract infection. This is also one of the most important questions for the 2 or 5 marks. So UTI is nothing but infection which occurs in any part of urinary system like kidney, then uterus, bladder, urethra, which all are most commonly caused by bacteria and can lead to the symptoms like a pain, burning during the urination and frequent urge for the urinate. So what all are the types? As a acute UTI and then chronic UTI. Acute means sudden onset of the symptoms which is typically resolved with appropriate treatment. Chronic means long term or the recurrent infection which may require the prolonged or specialized treatment and can lead to the complication. Lower UTI, which involves the bladder, causes the symptoms like frequent urination, burning sensation during urination and then cloudy or the bloody urine. So now come to the upper UTI or the pyelonephritis, so which is mainly affect the kidney and uterus as symptoms like a fever, flank pain, then nausea and vomiting. So now come to the next topic, that is causes of the UTI. So bacteria, most commonly the E. coli, which can enter the urinary tract to the urethra. Then sexual activity increase the risk particularly for the women due to this proximity of the urethra to the anus. Poor hygiene, which is wiping the back to front after using the toilet, can introduce the bacteria into the urinary tract. Then urinary catheter use, which provides a pathway of the bacteria to enter the bladder. Obstruction, any blockage in the urinary tract which can like kidney stones can lead to the stagnant urine and bacterial growth. Compromise the immune system, which is conditions like a diabetes or HIV weaken the body's ability to fight the infections, and the structural issues, anatomical abnormalities in the urinary tract which can increase the susceptibility to the UTI. Okay, so these all are the causes of the UTI. So now come to the pathophysiology. As example, for the renal calculi, this is as a etiological factor due to this obstruction of the urine flow. So urine can't flow to the bladder further. So what is happening? Stasis of the urine is happening. So due to this stasis formation, proliferation of the organism in the urinary tract. So due to this, urine tract infection is happening and complications of the urosepsis is happening. So what all are the symptoms? Frequent urination, strong persist urge to the urine, burning sensation during urination, cloudy urine, then blood in urine or the hematuria, then strong smelling urine, pelvic pain for the woman, fever and then chills more common in the upper UTI. Other than that, flank and the back pain which is indicate a possible kidney movement, and nausea and vomiting more common for the upper UTI. So what are the diagnosis? First is the urine analysis, test for the presence of WBC, RBC bacteria or any kind of the nitritis in the urine. Then now come to the urine culture, so which is mainly identify the specific bacteria which is causing the infection. Physical examination, they mainly check the signs of infection such as pain or tenderness in the abdomen or the back, and then imaging if it is needed means ultrasound, CT scan or MRI or detect the structural abnormalities or complications. Then cystoscopy in the recurrent cases, so a cystoscope is inserted into the bladder for look up the abnormalities. So what are the management? Pain relief like over the counter medications like ibuprofen or the acetaminophen. Hydration, drinking the plenty of fluids of the help flush out the bacteria. Then hygiene practices, proper wiping technique, urinating after the intercourse and avoiding the irritating feminine product. Now come to the avoid irritants, which is use of the caffeine, alcohol, spicy food and then artificial sweeteners. Then follow up for ensuring the infections has cleared, special especially in the recurrent cases. And then preventive measures, which is low dose antibiotics can vary the products as well as the probiotic which is recommended by a healthcare provider. Now come to the pyelonephritis. So what is the pyelonephritis? It's a type of the urinary tract infection which can cause the bacteria infects the kidney, leading to the inflammation. It also often results in symptoms like a fever, back pain and urinary issue. So this pyelonephritis is mainly important for the 2 marks questions. Okay. So what all are the causes? Bacterial infection, which is mostly common due to the E. coli, which is from the gestational tract. Now come to the urinary tract obstruction, which is blockage such as kidney stone or any enlarged the prostate. Then varicose ureteral reflux, which is backward flow of the urine from the bladder to the kidney. Then weakened immune system, which is conditions like a diabetes or the HIV. Catheter use, prolonged use of the urinary catheter. Pregnancy, which increase the pressure on the urinary tract. And then hormonal changes. So what all are the symptoms? High fever like often with chills, flank pain, pain in the back or side, then nausea, vomiting, frequent urination like urgency and increased frequency, then the painful urination, burning sensation during the urination, cloudy or bloody urine, and then fatigue. So what are the diagnosis? Medical history and physical examination. Mainly they are assessing the symptoms and checking for the tenderness in the back or side. Urine test, they are mainly checking the urine culture, so detect the bacteria and then WBC. Blood test, mainly blood culture for checking of the bacteria in the bloodstream and complete blood count for looking the signs of the infection. And then imaging studies, mainly they are going for the ultrasound or the CT scan for identifying the kidney abnormalities, blockage or the abscess. So what all are the management? Like antibiotics, initial treatment with the intravenous antibiotic followed by the oral antibiotic. Hospitalization, mainly for the severe cases that including those of the high fever, vomiting or sepsis. Now come to the pain management, use of the analgesic to alleviate the pain. Hydration, increase the fluid intake for help the flush bacteria from the urinary tract. Then follow-up care, it's a repeated urine test for ensure the infection has cleared. Then addressing the underlying causes with treatment of the underlying conditions such as removing the urinary obstructions or managing the chronic health issues. So what all are the nephrotic syndrome? So nephrotic syndrome is nothing but this is most important questions for the 5 marks. Okay, so nephrotic syndrome, it's also known as a kidney disorder which is characterized by excessive protein loss in the urine, low blood protein levels, high cholesterol levels and then swelling which is result from damage to the glomeruli and filtering the units of the kidney. Just remind, nephrotic syndrome is a combined disorder. Okay, why? Because excessive protein loss in the urine, low blood protein levels, high cholesterol levels and then swelling. So these all are the 4 types of characteristics are present in one disorder. So that is called nephrotic syndrome and it's mainly the damaging the glomeruli part of our kidney. So what all are the causes? Primary glomerular disease like a minimal change disease, focal segment glomerulonecrosis, then the membranous nephropathy. Now come to the secondary cause like diabetes mellitus, diabetic nephropathy, lupus, systemic lupus erythematosus, then amyloidosis, then infections under this hepatitis B, hepatitis C, HIV or the bacteria, then drugs, non-steroidal anti-inflammatory drugs, NSAID, and then cancer like lymphoma or the leukemia. So what are the genetic mutations like which is affecting the kidney function and then glomerular integrity? Okay, so what all are the symptoms? First is severe swelling, edema, particularly around the eyes, ankles and feet. Next one is the foamy urine due to the high levels of the protein or the proteinuria, weight gain from the fluid retention, fatigue, loss of appetite, high the cholesterol level, low blood protein level. It's also known as a hypoalbuminemia. So what are the diagnosis? Urine test which is like proteinuria, urine dipstick test, 24-hour urine collection. So blood test like low blood albumin level, hypoalbuminemia, high cholesterol level, kidney function test like creatinine and then blood urea nitrogen. Kidney biopsy under this microscopic examination of the kidney tissue, imaging studies like ultrasound or the CT scan, and then additional tests for the underlying causes like blood test for the infections of the autoimmune disease like lupus, hepatitis. So now come to the management. So under this medication, diuretics to reduce the edema, then ACE inhibitors or the ARBs for controlling the pressure and then reduce the proteinuria, immunosuppressive agent for the certain cases, as example steroid and then cyclosporamide. Now come to the dietary and then lifestyle changes. So under this, low sodium diet, balanced diet to control the cholesterol level. So monitoring and support, under this regulator monitoring we have to do for the kidney function, blood pressure and urine protein level, supportive care for our complications like infection and blood cells, then treatment for the underlying causes like addressing the primary or secondary cause of the nephrotic syndrome like managing diabetes, treating infections, and then kidney transplant. This is the last case where the treatment all the is going to be failed. Okay, so now come to the next, that is acute renal failure. This is also one of the most important questions. Acute renal failure is nothing but is a sudden loss of our kidneys ability to filter the waste from the blood, which is leading to the accumulations of toxin and then imbalance in our electrolytes. So what is happened? These conditions is developed rapidly over a few hours or days or requires the immediate medical attention. So what all are the causes? Perennial causes like severe dehydration, blood loss or the hemorrhage, then low blood pressure, heart failure or the heart attack, sepsis, severe infection, liver failure, use of certain medications, as example NSAIDs or HCE inhibitors. Now come to the next cause, that is intrarenal causes. So under this, acute tubular necrosis due to the ischemia or the toxin, glomerulonephritis, inflammations of the glomeruli, acute intestinal nephritis, allergic reaction to the medications, then rhabdomyolysis, muscle breakdown releasing the myoglobin, and then certain infections like a pyelonephritis. So now come to the third of causes, that is postrenal cause. So kidney stone, then ureteral obstructions like a tumors or the fibrosis, then bladder obstruction from the tumor, stone or the blood clots, enlarged prostate, as example benign prostatic hyperplasia, neurogenic bladder like nerve damage which is affecting the bladder function. So now come to the next, that is pathophysiology. So prerenal case. So under this, what is happened? Due to this etiological factor, as example hypovolemia. Okay, so due to this, what is happened? Kidney is become well stimulated. So due to this, renin, angiotensin, aldosterone system is also going to stimulate, and it's also constricting the peripheral as well as the renal artery. So due to this construction of peripheral renal arteries, what is happened? Glomerular capillary pressure is going to be decreased, and due to this decreasing pressure, decrease the glomerular filtration rate, and it's also leading cause of the oliguria. So now come to the next, that is intrarenal cause, intrarenal pathophysiology. So in this case, what is happened? When this tube is going to be damaged, the interstitial edema is occurring. So due to this, the interstitial edema, also necrotic epithelial cells is also going to accumulate in the tubules. So due to these accumulations, obstructing of the tubules again is happening, and which is causing the decreased GFR and increase the intratubular pressure, which leads to the ARF. Okay, acute renal failure. And normally what is happened? Due to this, the etiology such as BPH, calculi or the stricture, it's obstruction the normal urinary pathway, and due to this, what is happened? Hydronephrosis is occurring, and due to this, the hydronephrosis, damage of the renal parenchyma you can see, and due to this, decrease the GFR or the glomerular filtration rate, and due to this decreasing of the GFR, obviously acute renal failure. So these all are the pathophysiology of the acute renal failure. So what all are the symptoms? Decreased urine output or anuria, swelling in the legs, ankles or feet, which is called as a edema, fatigue, weakness, shortness of breath, nausea, vomiting, then confusion or the decreased mental alternate, chest pain or the pressure, irregular heartbeat, high blood pressure, seizure or the coma in our severe cases. Okay. Now come to the diagnosis. Medical history and physical examination, mainly they are assessing the symptoms. Medical history and physical examinations, blood test, mainly they are measuring the level of creatinine, then blood urea nitrogen, electrolytes, and then glomerular filtration rate. Then urine test, mainly they check for the abnormalities such as protein, blood and sediment. Then imaging studies, which is mainly ultrasound, CT scan or MRI for visualizing the kidney and then urinary tract obstructions or the structural issues. And then kidney biopsy, mainly this some cases the sample of the kidney tissue may be taken for identifying the underlying causes. So what are the management? Treat the underlying cause, like address the root cause such as infection, dehydration, obstruction. Medication, use the medication for managing the symptoms, control blood pressure and restore the electrolyte balance. Then fluid management, mainly they are going to administer the intravenous fluid for restore the hydration or restrict the fluid for prevention of the overload depending on the cause. Dietary modifications, mainly they are going to implement a diet in the low protein, potassium and sodium. Dialysis, which the dialysis temporarily for removing the waste and excessive fluid if the kidney function in severe impaired. Then continuously monitoring the kidney function, electrolytes, and then overall health adjusting treatment if it is necessary. Okay, so now come to the HIV and then AIDS. So from the urine chapter, these all are the most important topic. Other than that, most important topic for your upcoming exam from the urine chapter, that is bladder carcinoma, the formations of the urine and anatomy and physiology of the kidney. Okay, so along with those topics, just go through this three topic also. Now come to the next chapter, that is immunology. So from this HIV and then AIDS, so human immunodeficiency virus, it's the infection which is attacks the body's immune system, and it's also acquired the immunodeficiency syndrome is, which is most advanced stages of the disease, which is given by the WHO or World Health Organization. So HIV is nothing but it's a retrovirus genetic material which carried the form of RNA rather than the DNA. Okay, so now come to the HIV epidemiology and then disease. So WHO, which is reports the state that 38 million people in the world they were living with at the end of the 2009, and in our India 2.14 million cases they are going to present. Okay, so these are structure of the HIV virus. So now come to the transmission of the HIV due to this unprotected sex like anal, vaginal or the oral sex. Then sharing infected needles from the injecting drugs, occupational exposure like injection of the contaminated blood, as example healthcare workers is accidentally pricked with an HIV in contaminated needle. Okay, next is the reusing the infected instrument, maternal transmission like transform from an infected mother to the child before birth, during birth or after birth. Medical procedure like transfusion of the blood that contains the HIV, organ transplantation. So now come to the clinical manifestations for the stage 1 like asymptomatic and persistent generalized lymphadenopathy. For the stage 2 it is unexplained moderate weight loss, recurrent respiratory tract infection and oral infection, fungal nail infection and then seborrheic dermatitis. For the stage 3 unexplained weight loss and then persistent fever, oral candidiasis, then several bacteria infection, pneumonia or the meningitis, unexplained anemia and then pulmonary tuberculosis. For the stage 4 that HIV wasting syndrome, pneumocystis pneumonia, recurrent severe bacterial pneumonia, chronic herpes simplex virus, esophageal candidiasis, HIV encephalopathy, lymphoma, extrapulmonary tuberculosis, recurrent septicemia, symptomatic HIV associated nephropathy or the cardiomyopathy and invasive cervical carcinoma. Now come to the diagnostic evaluation. First is HIV status. So any opportunistic infections or any complication status of any family members concealing or the medical care. Chief complements like signs and symptoms and reason for the hospitalized. Significant recent medical history which is like a malaria, tuberculosis or STD or any other disease if it is present or not. Then relevant sexual history like sexual partner, sexual practice and use of the contraceptives. HIV antibody based test which is rapid test and ELISA test. Then HIV antigen based test, P24 antigen test and HIV PCR test means polymerase chain reaction, and based on the system involvement the investigation advises by the physician as follows like CD4 count and then viral load. Next complete blood count and then hemoglobin, liver function test, then sputum AFB and then serum creatinine, glucose profile, X-ray and then CT scan. So now come to the antiretroviral therapy. So antiretroviral therapy for this nucleoside reverse transcriptase inhibitor. So under this zidovudine you can see the lambivudine, stavudine, abacavir as well as the tenofovir. Now non-nucleotide reverse transcriptase inhibitor. So under this efavirenz and then nevareprin. And next is the protease inhibitor. So under this nelfiravir, dolopiravir, then indinavir and then ritonavir. Okay. So this before starting this antiretroviral therapy, people they have to talk about the necessity of taking drugs like a directed, not skipping any dose, taking the drugs for the rest of their life. So these all are the treatment management as well as detailed explanation regarding the HIV and then AIDS. Now come to the benefits of the antiretroviral therapy, which is mainly reverse course of the existing opportunistic infection, decrease the hospitalization, increase the survival rate, then restores the hope, improves the quality of their life, reduce the HIV transmission and benefits both adult and children. So now come to the next chapter like that is oncology. So from the oncology gynecology, most important topics I am going to teach you, that is cervical cancer. So under this cervical cancer, what is this? It's a type of the cancer which is occurs in the cells of the cervix and lower part of our uterus, which connects the vagina. It's also one of the most important cancer in our women worldwide, but in largely preventable as well as treatable if detected early. So first we have to know what is the meaning of the cancer. Cancer is nothing but it's a like accumulations of the cancer cells. Okay, so when in one of our body part, when the cancer cells is becoming accumulated rather than the normal cells, so what is happen, it's going to be very impacted in our cells tissue structure, and it's also going to spread from one side to another side, means one part to another part. So that time it's called as a cancer. So same as like when this abnormal accumulations of our cells is happening if our cervical part, so obviously that time it will be considered as a cervical cancer. Okay, so what all are the causes? First is multiple sexual partner, then early sexual activity, weaken the immune system, then smoking, long-term use of the birth control pills, then other sexual transmitted disease if it is present, and then low socioeconomic status. So what are the symptoms? First symptoms as like abnormal vaginal bleeding, unusual vaginal discharge, pelvic pain, pain during intercourse, painful urination, bleeding between periods, and then heavier or the longer menstrual period, bleeding after menopause. So what all are the diagnostic diagnosis? First is the early stage. So on the early stage, often asymptomatic, but it can include the abnormal vaginal bleeding like postcoital, intermenstrual as well as the postmenopausal, vaginal discharge and pelvic pain. So advanced stage symptoms which may include the more pelvic pain, difficult urination and defecating, as well as leg swelling and weight loss. So screening like a pap smear, cytology, HPV DNA testing, then colposcopy, mainly visual examinations of the cervix with a biopsy if abnormal areas are seen, biopsy, histopathological examination for confirmations of the diagnosis, imaging like MRI, CT scan or PET scan, positron emission tomography for tagging and assessing the metastasis. Okay, so now come to the next, that is treatment modality. So under this early stage, for this colonization loop electrosurgical excision procedure, LEEP, hysterectomy means simple or the radical hysterectomy is nothing but like a removal of the uterus, as well as the trachelectomy. Okay, so now come to the next, that is radiation therapy as well as the chemotherapy. So under this cisplatin based regimens we have to provide as a medication. Now come to the targeted therapy and immunotherapy, and the advanced stage, what is the treatment? That is pelvic extension. Okay, so now come to the next point, that is the treatment. So what is the treatment? Surgical treatment. In the early stage we have to go for the unilateral or the bilateral salpingio-oropectomy, hysterectomy, omenectomy as well as the lymphadenectomy, and in advanced stage debulking surgery for remove such as much as tumor is possible. For the non-surgical treatment like chemotherapy, platinum based chemotherapy means the carboplatin, cisplatin, which is often combined with the paclitaxel, as well as the targeted therapy like a bevacizumab, anti-VEGF, then PARP inhibitors like olaparib as well as the niraparib we have to give, and BRCA mutated cancer to prevent, means especially the breast cancer. Now come to the hormonal therapy. For the sex cord stromal tumor, use of the drugs like a tamoxifen as well as the aromatase inhibitor, and in the radiation therapy we have to give the less commonly used but may be applied for the specific cases for the palliation. So now come to the next and most important question, that is breast cancer. So breast cancer is same like abnormal accumulations of the cells and tissue is occurring inside of our breast. So breast cancer is a kind of cancer which begins as a growth of the cells in our breast tissue after skin cancer. Breast cancer is one of the most common. Okay, so what are the causes? Genetic factor. Next one is the inherited mutations such as BRCA1 and BRCA2. BRCA is nothing but breast cancer gene 1, breast cancer gene 2, TPF gene 3, and then family history of the breast cancer. Hormonal factor like early menarche before the age of the 12 or the late menopause after age 55. Hormonal replacement therapy, especially the combined estrogen progesterone therapy. Reproductive factors like null parity, never having given birth, first full term pregnancy after age of the 30 puberty and lack of the breastfeeding. So what are the causes? Lifestyle factor like obesity, especially the postmenopausal obesity, alcohol consumption, physical inactivity. So environmental factor like exposing to the ionizing radiations, chemical exposure like the certain pesticide, and then other factors like personal history of breast cancer or certain non-cancerous breast diseases. So what are the clinical manifestations? So local symptoms like lump in the breast or the underarm, change in the breast shape or size, skin changes like dimpling, redness and then puckering, nipple changes like inversion, discharge and scaling, as well as the persistent in the breast milk. So other symptoms like fatigue, unintentional weight loss, then unintentional weight loss, then symptoms related to the metastasis, as example the bone pain, jaundice, shortness of the breath. So what are the diagnosis for the clinical examination like physical exam for the breast and then the lymph node. Next, the additional tests like blood test for the tumor markers, genetic testing for the breast cancer gene 1A and 2 as well as the other mutations, and then histopathological analysis which is mainly determine the tumor type, grade and then receptor status, ER/PR as well as the HER2 gene, and then biopsy like fine needle aspiration, core needle biopsy and then excisional biopsy, and under the imaging studies like mammography, ultrasound and then MRI. So what is the treatment modalities? First is the surgical treatment, mastectomy, lumpectomy, removal of the tumor or some surrounding tissue, axillary lymph node dissections, then sentinel lymph node biopsy as well as the non-surgical treatment. So under this mainly radiation therapy, targeted therapy, immunotherapy, hormonal therapy as well as the chemotherapy. Okay, so now come to the next so from this the oncology chapter, these all are the most important frequent asking questions. Okay, other than that you also have to focus regarding the drugs, which all are the drugs is using in our oncology. Next one is the chemotherapy. So chemotherapy drugs, especially the chemotherapy drugs means based on the categories, this the classification they are also frequently asking. And next one is the sarcoma. Okay, so other than this the chemotherapy also there are so many therapy as a treatment modalities, as example like immunotherapy, then targeted therapy, cell therapy, etc. So everything you have to do it. So the questions is most important, that is treatment modalities of the cancer. So that time surgical, non-surgical as well as the others. These 3 points also you have to include, including the all the therapies as well as the including all the drugs name. Okay, so these all are the most important part from the oncology. Sometimes very few rare questions they are asking as a like cancer process. So that time you have to give the answer as a how the cancer means how the cells are becoming cancerous. Okay, so that process you have to give to the answer. So now come to the next chapter, that is disaster. So from this the disaster important is what is the meaning of the disaster as a 2 marks question. So disaster is mainly defined as an any occurrence which cause the damage, ecological disruption, loss of the human life, deterioration of the health and health service on a scale sufficient or to warrant the extraordinary response from outside the affected community or area. So what are the key elements like speed, then threat, urgency, uncertainty, unfamiliarity, unpredictability. So what are the alphabetically means? See, D means destruction, sometimes I means incidents, then A sufferings, A like stands for the administrative financial failure, then sentiments, T stands for tragedies, E stands for erection of the communicable disease, and R stands for research program. So commonly the alphabetically D stands for detection, I stands for incident command, A stands for safety and security, A stands for assess, A stands for support, T stands for trials and treatment, E stands for evaluation, and R stands for recovery. Okay. So now come to the disaster nursing. What do you mean by the disaster nursing? So it's mainly involves the responding to the natural and then man-made events which is mainly affect the entire community or the communities which is involve the massive number of the casualties as well as extensive property damage. So what are the principle? Rapid assessment of the situation, trials and then initiation of the life-saving measures, use of the essential nursing intervention, evaluation of the environment and then mitigation, then prevention of the further injury or the illness, leadership and then coordination, and last one is the providing emotional support. So what are the types? Mainly 2 types, based on cause or origin, based on the speed of onset. Based on causes or origin like natural disaster. Next one is the man-made disaster, means the people are only the responsible for becoming to create a disaster. Next one is the based on speed like sudden onset, like suddenly the disaster is coming. Next one is the slow onset, it is take some months or some days to outbreak for as a disaster. disaster. Now come to the levels. Mainly there are three levels: level 1, 2 and 3. So level 1 means before coming the disaster. Level 2 means at the time of the disaster. Level 3 means post disaster period. So now come to the phases. So mainly there are three phases. First is pre-impact phase, means before outbreaking. Next one is the impact phase. So when this disaster landing already, so after that how it's going to impact our community and then people. And last one is the post impact phase. Okay, so now come to the disaster management cycle. This is also one of the most important individual question as a 2 marks or the 5 marks. So this cycle you have to know response. So when this disaster is outbreak already, so at that time how the healthcare workers and how the healthcare management of our government of India is going to be respond for recovering of the people. Okay, so that is called response. Now come the recovery. So when they reach to that particular area, so after that how they are going to help for the recovering the people from this particular tragedy or particular situation. Next one is the development. So after recovery how they will going to develop a proper tragedy or proper solutions to minimize the outbreaking of the disaster. Okay, next one is the mitigations, means how they will be prepared the people for the next time disaster and how they will be resolve this particular issue at that same time. So that is called mitigation. And last one is the preparedness, means before upcoming the disaster they have to give the proper information prior itself. So what will happen, the people, means community people, they can able to manage their some property or some other things, as well as the less number of death also going to be occurred. Okay, so that is called preparedness and this is the disaster cycle. Okay, now come to the purpose. So what is the purpose? First is disaster trials. So first, what do you mean by the disaster trials? This is also one of the most important individual question as a 2 marks or 5 marks. So trials is nothing but it's a process of the determining the priority of the patient's treatment based on the patient's condition, means severity of the condition. So what is the purpose? Meet the immediate needs. Second one is the infrastructure limitations, then inadequate hazard preparation, limited transport capabilities, multiple agency responding, hospital resources overwhelmed. Okay, so what is the types? Mainly two types: START, start, and second one is the advanced type. So in this the start there are so many phases are there. Phase 0 means the decrease who are the beyond need, beyond help. Okay, so some people that's not that much severe, so they don't need immediate help, so beyond help. Stage 1, the injured who can be helped by immediate transportation. Stage 2, the injured whose transport is delayed, means there are some people who are having suppose as example severely the people is injured, so they need immediate action. So that is stage 1. Stage 2 means some people they're having only some suppose some ages is happening on the head or leg or hands or any part, so then no need that much of the immediate treatment. Okay, so for those the stage 2. And stage 3 who has a minor injuries who need help very less urgently. So now come to the advanced. So class 1 means red means indicate the severe injured. Okay, severe injured, so they need the immediate medical attention, they have to admit the hospital immediately. Okay, now come to the class 2, that is yellow, they need medical help, but if it is be little bit late, but it will not be impacted on their health status. Next one is the class 3 greens, means beyond of the help, and class 4 is the black, means death. Okay, so this based on the severity of the patients we have to give the proper treatment, means sending the patients from the disaster situation to the hospital. So now come to the So these all are about the most important from the disaster. Okay, other than that, also one of the some more important topic are there, like disaster nursing during the bites, any bites, disaster nursing during the poisoning, disaster nursing during the thermal emergency period, disaster preparedness. Okay, so these all are also most important topic from the disaster chapter. Other than that, disaster nursing as a one of the most individual question. Okay, so now come to the next part, that is CCU or critical care nursing. So under this, what are the types? First is coronary care unit, medical intensive care unit, surgical intensive care unit, pediatric intensive care unit, neurological critical care unit, shock or the trauma intensive care unit, neonatal intensive care unit, psychiatric intensive care unit, burn wounds or the intensive care unit, and geriatric intensive care units. Okay, so What are the 7 C's of the critical care? First C is the compassion. Second C is the communication with the patient and family, means the IPR. Then considerations to the patient's relative or colleagues or the avoidance of the conflict. Then comfort, prevention of the suffering. Next is the carefulness, avoidance of the injury, consistency and closure, ethics or withdrawal of the care. So now come to the semicircular plan of your CCU. So this is the first is operation theatre. Under this recovery room should be there. Near to this recovery room CCU, near to this radiology come imaging department. So in the CCU, other side it will be like step down or the high dependency ward and physiotherapy ward. Other than that, casualty and the laboratory it will be present. Okay, so operation room, it's a very sterile environment which should be equipped with the performing surgical procedure. Then recovery room, post operative area where patients is closely monitored. Next one is the CCU, or critical care unit, specialized unit mainly providing the intensive monitoring and treatment for the critically care patient, and radiology, which is equipped with the imaging technology such as X-ray, CT scan, USG or MRI for diagnostic purpose. Then ideal CCU plan and physical setup. See, these are the row 1, 2, 3, 4, 5, 6. So in the first row, what are things should be there? 7 single room should be there, storage should be there, bathroom, pantry, cleaner, then conference room. So and from the 2 to 5 level, it should be like central nursing station, clean utilized room as well as a soil utilities room. Okay. So at the back of this, the second row, that office and then interview room should be there. Okay. In the 6th row, what should be there? Like 8 single room, storage, bathroom, staff facilities and relative washing room. So sometimes in the questions they are asking the structure of the CCU, so that time you have to give this. Okay, so it is important for the 2 marks questions. So central nursing station, why it is present? Because they can follow the, they can monitor the patients and coordinate the care, and they can also quickly respond during the emergency situation. And clean utilities room, which space for the storing the sterile supplies as well as the equipment. Okay, then soil utilities room, which is used mainly temporary storage and handling of the contaminated items. And single rooms is nothing but it's a private patient room, which is mainly ensuring the individualized care and reduce the risk of the cross infection. Each room, it should have the necessary medical equipments as well as the comfortable recommendations. So these all are the most important questions from the adult health nursing too. Okay, other than that, in the neurology chapter, so I can't give you the important topic from the neurology chapter, because in the neurology these all are the most important questions. Every questions, as example hemiplegia, paraplegia, amyloidoplegia, as well as the intracranial pressure, heart stroke, everything, each and every questions are important. Guillain-Barré syndrome. Okay, so now come to the occupational disorders chapter. So in this the occupational disorders chapter, like bagosis, silicosis, then psychosis, as well as pneumococcosis. So these all are the most important questions for the 2 marks. Okay, so you just make sure that occupational disorders, this chapter important for the 2 marks. Other than that, like elderly care patient. So from the elderly care, which all are the questions are important, like prosthesis, okay, hearing aids, as well as the ethical and legal issues for the elderly. So these ethical and legal issues for the elderly, so these questions, as well as the elderly abuse. So these 2 questions are important for the 5 marks and then 10 marks question. Other than that, important questions like orchitis, then infertility and its management, then epididymis, as well as the gynecomastia, okay, myasthenia gravis. So these all are the most important topic for your upcoming exam. So along with these questions, just go through those questions also. So thank you. I hope you all understood my session. Again, we'll meet in next live session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you.